Hi, my name is Bailey McAllister, and I'm going to be doing a Foley Catheter insertion and removal. So, first, my supplies. I would have a new Foley kit, a fresh pair and package of sterile gloves, regular gloves, and for removal, I have an empty syringe and then some paper towels. So, first thing, I also want to wash my hands before I go into the patient's room, and then I can go to the patient's room. Hi, Ms. Smith. My name is Bailey. I'm going to be your student nurse today. I have a doctor's order to go ahead and place a Foley catheter. I want to ask if she has any allergies to iodine, betadine, or shellfish, or any other reason that we wouldn't be able to do this. Explain to the patient why we'd be doing this. This would be helping her urinate. And then I will put my gloves on. And I will perform peri-care on the patient, making sure I provide her privacy and everything. So I'm going to expose the patient, again, talking to her the whole time, educating her on everything that's going on for dignity. And now is when I would perform peri-care. After I've performed peri-care, I can dispose of my other gloves, and I would just throw them away, wash my hands, and then I would do this before, put this under her as well. Wash my hands, and I can now open my clean and sterile Foley kit. So I would just take this, this sticker I will keep. Okay, for this I just want to make sure I'm touching the outside, and I can touch just an inch inside of this barrier.
I've already educated my patient on the procedure.
Going outside of the sterile field, not directly over.
Okay, this would be legal snap, but for today we are going to use mineral oil.
Okay. Before I touch any of this, I'm going to go ahead and put my sterile gloves on. Again, I would have a new package of them. And I'm going to open these away from the sterile fields of this. Ignore this, this would not be in the way. Okay, so I have my 1-inch border. And then open them like this. Only touching the inside at first.
Okay, so it should be in the lubricant.
And then sterile can touch sterile.
Okay, and then now that I'm ready to actually enter the
Okay.
Foley into my patient.
Now I can go ahead and touch everything in here. I don't need, and I'm keeping my hands in front of me so that they're staying in sterile fields. Just dropping the things that I don't need. Okay, I will need these, so I can go ahead and open this. Just one of them though is all that I will need. Okay, and then I will also need my flush and my package of glue, and then I no longer need that. Okay, so I can put all of this inside my box, and I will grab it like this and place it right here. Okay, this whole time I want to make sure I don't touch my patient yet, and that because I'm still being sterile, but I will open this,
clean all of it.
drop what I don't need.
I'm going to insert it and educate her that it should
I can go ahead and attach this to my catheter so it is ready.
1, 2, 3.
And then,
insert about 3 to 5 inches until we get urine output. Once we get urine output, I'm going to
leave that in here. And then whenever I'm taking this lining off, just being careful to keep this inside of this box.
once I have that done, I'm going
Just kind of
to
bunching
touch
it in my
to
hand.
make sure that this is secure and that balloon is sitting at the bottom of the bladder. And to undo my saline.
Okay.
I would secure this to my
So,
patient's leg, over the
For
leg,
this, I don't have
and I
lube
would hang it
that I can use for the mannequin, but
on
I would go ahead and open this, and I
the
can
frame
put
of
the
bed for how many
end
years.
of
It
the
would be
catheter
attached to the frame of the
in
bed.
this lube and leave it sitting there while I'm getting her ready.
I would make
but
sure
I don't
there's
need
no
it.
kinks.
Okay,
or,
still keeping sterile filled. I'm gonna go ahead and clean my patient.
Rounds
Again,
of
the
my
whole time
lube,
just educating her
really
on what's going
gravity
on,
is taking that urine out, and it's not
so you're not
pushing it back
violating
into
her
my
privacy.
patient.
But for this,
If I
you will
needed
take
to
the first
collect a
one
urine culture,
and
this is where I
not
would take
touching
it
the outside of
from.
her leg,
The first input into
side
the
of it,
bag.
drop,
Okay.
get a new one,
After that is
The
done,
other
I'm going
side,
to gather my supplies.
drop, and then middle, and drop. Okay, now she is clean. I can go ahead and insert the
I'm
catheter.
going to get her back into a comfortable
Okay,
position.
so again, it will have some lube on it. I will insert it 3 to 5 inches. Once I see urine, I will go ahead and insert 1 to 2 more inches, and then I am done. So just letting her know that I'm gonna go ahead and insert it. Also, I would have broke sterile filled with my left hand and held at that point. I did forget to do that, but you can break that, and then so now sterile filled is broken, and I can go ahead and insert it. Just letting her know it shouldn't be uncomfortable or painful, but just to let me know if it is. Okay, and then I can go ahead and hold that with my left hand. Since this is a 5 milliliter balloon, I will insert 5 milliliters to fill up the balloon.
Foley's size for my documentation. Okay.
And then,
For removal, so
detach
it's been a couple
this.
days for my removal.
okay, so I will also give it a light tug just to make sure that it is in there and the balloon is inserted.
For my removal, I'm going
This
to make sure I have a doctor's order.
will have a
for
sticker
removal of the
to
Foley.
stick to the side of her leg. And then I will make sure that this isn't tangled or has any kinks in it and hang it on the actual bed frame,
Then I'm gonna go into
not
my
the rails
patient's
of the
room,
bed.
identify with main
Um,
date of birth,
so that if it moves,
because
it's
I
not
do have
tugging
an
on
order
her.
to remove the Foley,
At this point I'm done, so I can just throw
and then we'll take it out.
all of this away.
So, no.
And
Hi, Mrs. Smith.
obviously I will
Tinsley, I'm going to be your
put her all back
supervisor. I
together,
do have a doctor's order to take the Foley out.
and make sure
It looks
she
like
is
you
not
were
in
waiting
pain
pretty good,
and
so
comfortable,
you're ready for that to come out.
that she
If you have
has
any
her
questions,
possessions.
it should be quick,
And once I see urine output, I'm gonna go ahead and look at it and see if how much she put out, what color is it, the clarity of it. And then I will also document, obviously, my name, the patient, that I verified who she was, and that I will have it on the right patient. That there was a doctor's order to do so, how big the catheter was. This one is 12 French, and then that I inserted 5 milliliters or cc's, and how she tolerated it. Yeah. So then a few days later, when I have the doctor's order to remove it, I will have wash my hands and have new gloves on. But I would just let them know, hi, my name is Bailey. I have an order to remove your catheter. Educating her the whole time of why, seeing if there's any questions from her. Once we're all good and I've washed my hands, put new, just regular gloves, they don't have to be sterile gloves on, I can go ahead and remove it. First thing I want to do with the full catheter bag or anything that's left in it, empty it into a urinal. Again, noting how much came out, if there was an odor, the clarity, the color, all that good stuff. And then I will take the sticker off of her leg before I remove it. I will have a empty syringe as well, and I am educating her the whole time as well. And I want to pull out at least 5. You want to, everything you put in, you want to pull out. And then you can do it twice just to make sure that you've got everything out of there. And then just let her know this shouldn't be uncomfortable. I'm just going to pull it really quick. And I have another paper towel just so I can catch it in there. 1, 2, 3. And catch it in the paper towel. Dispose of all of this in a biohazard bag whenever I'm done with it. Ask my patient, is she hurting right now? How is she doing? Making sure she's okay. Cover her back up. Assessing if she's in any pain, if she's comfortable in her position. Again, when I went back in there, I'd make sure that I had the right patient, all of this, and that she's all good. I'll let her know that if she has the urge to pee after we removed it, to let us know. We want her to pee at least like within 8 hours or less after we remove it. And when she does, to let us know so we can go with her and watch to see what it, all of the things that you look at in the urine, color, smell, all that, and make sure that she was able to urinate afterwards. And then documenting that you did all of that, how much came out, that she tolerated removing it well, that you did go ahead and pull out as many cc's that were put in, and that you did all of your patient care and safety afterwards. Thank you.